Hi, welcome to this month's community education class for HealthyU, sponsored by Kaleida Health. My name is Dr. Melissa Wanzer, and I'm here today to talk to you about cancer survivorship. So I want to tell you just a little bit about myself. Again, I'm Dr. Melissa Wanzer. I am formerly a professor in the communication department at Canisius College. I was there about 26 years. I'm a health communication researcher and instructor, and I'm currently in the role of the Oncology Survivorship Program and Outcomes Manager at Great Lakes Cancer Care Collaborative. And I'm also a cancer survivor, so I have unique insights into cancer survivorship and what it involves. Today, I want to talk to you about kind of two important things. First of all, what is a cancer survivor? Who is a cancer survivor? The second thing, then, within that same goal, I want to talk about cancer survivorship resources and programs available to patients. And then the second major objective that I have is to talk a little bit about the benefits of obtaining a survivorship care plan. So what is a survivorship care plan? What does it entail? And what are the benefits of opting in or requesting a survivorship care plan? There are three kind of broad phases or stages of a cancer diagnosis. Patients are diagnosed initially, and there are biopsies and tests to determine what type of cancer someone has. And then there's treatment, some kind of active treatment that could involve surgery, radiation, chemotherapy. And then there's the post-active treatment. And this is where we generally talk a little bit about survivorship. But I'm going to share some information that many of you might not know as to what constitutes a survivor, a cancer survivor. So interestingly, the National Cancer Institute and the American Cancer Society define cancer survivors as anyone who has ever been diagnosed with cancer, no matter where they are in the course of their disease. So one person shared this story with me. If you can say the word survivor, you are a cancer survivor. So really, a person is considered a cancer survivor from the time of diagnosis throughout the course of their disease. Interestingly, in my own personal research, we found that roughly 50% of individuals who've had cancer don't identify with that term cancer survivor. So we did a deep dive into this and looked at what are some reasons that people don't identify, or in some cases do identify, right? There's around 50% of people do identify with that term and 50% don't. What are some explanations that former cancer patients gave for why they do or do not identify? A lot of out of the 43 people that we interviewed, many of them said, I don't consider myself a cancer survivor because I didn't go through enough. I didn't go through chemotherapy, radiation. I didn't go through multiple surgeries. My cancer was easy. So they compare themselves to or benchmark themselves against other cancer survivors. Some people just don't identify with it because they have problems with that label. I don't like the term survivor. I'd rather be called something else, or I'd rather have no label. And then for other people, there's still about 50% of people who do identify. They feel like that label offers a sense of accomplishment. I beat cancer. They feel that that cancer experience, that illness was life-changing. It changed my life. It changed the way I view my health. Some people also, again, feel apathetic towards it. I try not to think about it. I don't have any thoughts. I'm not engaged in that term. And then we finally found that for some, they felt uncertain. I'm conflicted. Sometimes I like the label and sometimes I don't. And why is it important? Why is this identification or non-identification important? Because if you are going to label your services cancer survivorship, right, and say, well, we hope you'll participate in cancer survivorship services and programs. If people don't identify with that label, they don't see that as who they are, they may or may not choose to participate in those services. So one of the things I want to do is give some really good news. An estimated 17 million survivors are currently living full lives, right? So there are an estimated 17 million people who had cancer and are surviving that illness and managing it. From 1991 till 2019, the death from cancer decreased by 32%, and that's substantial. So we have almost 3.5 million fewer deaths from cancer, which is really good news to share. And we don't often share the good stuff, and I think it's important to push that out there. So how did we get there? How did we get to these numbers? We got to these numbers, first of all, because there are improvements in prevention. There is more information, thankfully, around how we can stay healthy and how we can prevent cancer. I love sharing this acronym, right? So how can we prevent cancer? TED. Remember TED, right? Tobacco, exercise, and diet. Don't smoke, right? We shouldn't smoke. Exercise, we need to do about, and you'll hear this number again, 150 minutes of exercise a week. And then diet, we really need to take a closer look at our diet and what we're eating. You know, can we eat a plant-based diet? Can we eat more fruits and vegetables? And that's something that is helping in prevention. Obviously, screening. We have a much greater push for people to go and get screened for cancer. The earlier we can catch it, the earlier we can detect cancer, the more, the greater chance of positive outcomes, right? The better that people will do. So you're always hearing, hopefully hearing messages from ACS and other cancer organizations saying, get your screenings, and then describing what the criteria, the specific criteria are for getting those screenings. So we have prevention, TED, tobacco, exercise, and diet, screening, get screened. We can get an earlier diagnosis. And then the fourth piece of this are improvements in treatments, that the treatments are getting better and there's greater success across different types of cancer in outcomes. So the NCCN, or the National Comprehensive Cancer Network, has guidelines, right? There are specific guidelines around cancer survivorship. There is a lot more what I would describe as standardization, right? Standardized information in what cancer survivorship should encompass and what our goals and objectives should do, right? So we have these great outcomes, more people surviving cancer diagnoses, but what do we do with them and how do we help them recover from cancer, right? Recover from that, but also promote health, stay healthy, and prevent future cancer diagnoses. So you can see from the National Comprehensive Cancer Network guidelines, once again, cancer screenings, right? That people need to get screened. And once you've had cancer, it's really important for you to stay on top of those cancer screenings and continue to get them regularly, not just for your primary cancer, but other cancers. So as a breast cancer survivor, as someone who had breast cancer, I am at greater risk. And so I will make sure that I get scanned for get my screenings for colorectal cancer, cervical cancer, and any other cancers that I might be at risk for because of my illness and the treatments that I received. So again, here comes that number, right? We want to make sure that everyone is engaging in physical activity, at least 150 minutes a week. I watched an amazing webinar a couple weeks ago on exercise, and they talked about the fact that this should be something that is like prescribed. First of all, it should be prescribed to all of us, but especially individuals who've had cancer, right? That individuals who've had cancer can reduce their risk of recurrence for anywhere from 31 to 50%. That's substantial by exercising regularly. So and they've quantified it, which is awesome. Now we know how much should we exercise? 150 minutes a week, and that will reduce our chance of recurrence. Again, healthy eating is important. That's part of the standard. And then preventing infection. So we should be getting our vaccinations regularly, our flu vaccine, our COVID vaccine, and make sure that we don't get any infections. So I know there's a lot of information on this slide, but I want to talk about what Great Lakes Cancer Care Collaborative is doing to align themselves with Commission on Cancer Survivorship goals or objectives, criteria for cancer survivorship. So what are we supposed to be doing? And as I said, as we have more survivors and more growth in this area, we want to put forth guidelines and expectations of how to help people live healthy and full lives after their cancer diagnosis. So what do the guidelines look like, right? For the Commission on Cancer, first of all, you need to develop a program that meets the needs of your cancer patients. So we need to look at, what do cancer patients need, former cancer patients or survivors, what do they need to stay healthy and well? We know they need to get screened, they need to be exercising, they need to eat healthy, right? So the other recommendation is you have an actual program, you have a coordinator of that program, you have a team that comes together and talks about survivorship and talks about what your community of survivor needs. And then you have specific programs and services that are offered. And that's what I want to mention today. There are many different programs and services that can be offered under the COC guidelines. But I'm just going to talk about a few of them, right? First of all, our treatment summaries or survivorship care plans, seminars, rehabilitation services, nutrition programs, and support groups. So now I want to talk about specifically how we address that, right? We certainly feel that we have a program that attempts to meet the needs of patients. We have a program coordinator. Jennifer Wosick is the current coordinator, and I will be assuming that role in 2023. We have a team of 15 providers and staff that makes up our cancer survivorship team that looks at and assesses what our patients need. And then we have specific programs and services. So I'm going to talk in a minute about survivorship care plans, what they are. That's Jennifer Wosick, who is at GPPC. We have monthly education seminars. So we're offering educational seminars monthly on issues such as nutrition, right? Where did you hear that from, right? Nutrition and how cancer patients can eat healthy to, again, eat healthier, make healthier choices to reduce cancer recurrence. We have rehabilitation. I'm sorry, I want to go back to the seminars. We also have, we just had a seminar on lymphedema, and we talked about what lymphedema is and how to identify symptoms or signs of lymphedema to get treatment for that. We also offer rehabilitation services through Buffalo Therapy. We have certified lymphedema therapists. We have nutritionists, right, as part of GLCCC comprehensive care, survivorship care. We have nutritionists that you can work with to help you during treatment and after treatment to stay healthy. Kathy Kornacki, who is a certified nutritionist and part of GPPC. And we also offer emotional support groups. And those emotional support groups are free. They're offered monthly and at DeGraff. So there are information. I'm going to share a screen that shows you how to find out about these different services and sign up for them. One thing I want to talk about for a minute is these monthly seminars that we're holding. So we have started doing more outreach in terms of education. How can we educate people, particularly cancer, right? Individuals affected by a cancer diagnosis who have for the most part, who have completed their active treatment, right? So they're roughly, 3 to 6 months out of their active treatment. And how can we help them to, stay healthy and prevent future cancer recurrence? So we're offering monthly seminars, as I said, on nutrition, lymphedema, pain management. These seminars are at different locations. They're at different places, like our Spindrift location. Our next seminar will be at the Cancer Care of Western New York. But we're rotating the locations of these seminars to try to reach different patients, different patient populations, and to put these out into the community so they're more accessible for former cancer patients. And we hope to, in our next program, which is December 7th, we hope to talk about what do survivors need, right? So that next program is December 7th. It is at Cancer Care of Western New York. We're going to ask survivors to come to this conversation essentially and talk about what do you feel that you need? What types of education, what types of services should we make available for you? And I think it's a great opportunity. These seminars have been wonderful to bring people together with a similar illness experience and to talk about, again, what they need moving forward, what obstacles they're facing in staying healthy, both mentally and physically. One of the things we're trying to do in building this committee is a community of survivors is work with different partners, such as the Breast Cancer Network of Western New York or Buffalo Therapy, and work with these folks to offer resources that will benefit our patients. So I want to talk just briefly about a survivorship care plan. What is a survivorship care plan? Essentially, this is what happened and what's next. That's the most simple way to explain this. A survivorship care plan is a summary, often includes a treatment summary. Here is the treatment. Here is what medications, what chemotherapy, radiation, what you had. Here is the name of your the cancer that you had. It often includes information about the stage of cancer. So detailed information about your diagnosis, as well as your treatment, right? So what did you have? What treatments did you have? And then the other part of the survivorship care plan is what's next. What needs to be on your radar as far as keeping healthy? What screenings do you need? What tests do you need to stay healthy and well? The survivorship care plan is part of our comprehensive services, and you can obtain that from our provider, Jen Wosick, who is part of GPPC, who operates out of our Spindrift in Williamsville, Great Lakes Cancer Care Collaborative in Williamsville. And that survivorship care plan is useful for a number of reasons, right? So it's useful because it stimulates a conversation with your oncology provider, right? Here's what happened to you. Here's what your treatment was. Let's review it. Let's talk about it. And then here's what you need to do to stay healthy. And that conversation is probably just as important as that document. Going over again, putting that diagnosis into words. Let's talk about what this is and clarify, right? Ask any questions. And then the other part of this is then that patient has a document that they can share with their primary care provider. So they have something they can take to their primary care provider when that primary doctor has questions about their cancer. So we did a study, Jen Wosick and I, Jen is, again, our survivorship, our clinical survivorship person, and we studied individuals who received survivorship care plan. So about 154 individuals who received a survivorship care plan and then had a conversation with their oncologist, because in some instances, people just get the care plan, right? They just receive it, but there's no conversation. So in cases where they received it and they talked about it, they had a conversation with their oncologist, those individuals were certainly more who understood it too, right? They understood their survivorship care plan, what happened to me and what needs to happen to me next. They were more satisfied with their communication with their oncologists. They were more satisfied with their communication with their primary care physician. They went back to that physician and had a conversation about their cancer diagnosis and treatment. They reported greater health confidence. They were more likely to identify. We talked about that identification with the survivorship label. So they were more likely to identify and see themselves as cancer survivors, which we think, right? And I don't want to say this is a causal relationship, but it's correlational. They also were more likely to utilize survivorship services. So take advantage of education seminars, screening programs, and all these services that they had available to them. So a survivorship care plan may not be offered to you, but is something you might want to ask about. How do I get one? Where do I get one? What is the process for getting a treatment summary? And in some instances, physicians will just give out a treatment summary. Here's what happened. And in others, they'll say, here's your treatment summary. Now here's the what's next. Here's where you will go to be screened for additional types of cancer, or here's what you should keep on your radar. So to wrap everything up that I've talked about today, I would first start by reiterating that not everyone identifies with that cancer survivor label. That is something that is interesting to me as a communication person and as a message person, because if individuals do not identify with that, then is there a chance that they're not pursuing cancer survivorship services and resources that would help them stay healthy? My hope is that that's not the case. But, the cancer survivor term is important because we have to call this group of people something. And so when we ask, for example, in my research, when we ask people, well, what else would you like to be called? There was an agreement, right? That you can imagine people, some like warrior, some like thriver, some don't want any label or name, but how do we reference this group of people? And that is an interesting question, right? It's important, I think, for us to emphasize what happens in the after. What happens when someone is done with their treatment? What is the standard of care? And this is what we are trying to develop as I said, with the COC and the NCCN. They're trying to push out guidelines and standards to say, okay, after people are done with their active treatment, this is what they need to do to stay healthy and well, right? They need to get screened, right? They need to exercise for 150 minutes a week. They need to eat healthy. They need to prevent infections. And so we need to be offering programs, services, and resources to help them achieve those goals. So, my suggestion is if you're interested in receiving a survivorship care plan, to talk to your oncologist about obtaining this, either, again, and sometimes they separate them out. Here's a treatment summary, or a survivorship care plan, which includes a treatment summary and a what's next for you to follow through on your health. So to request that. If you have additional questions that maybe I didn't answer, all of the questions that you had about survivorship, please reach out to me. This is my email at Kaleida, and I'm happy to correspond with you and answer your questions or direct you to someone. To learn more about Great Lakes Cancer Care Collaborative, this is our website. Visit the website. If you're interested in some of the free resources that we have, go to the events page, and you'll see we have the sign up for the upcoming lecture on December 7th, which is What Do Survivors Need, right? What do survivors want? What resources are available? That's, again, December 7th at 6 o'clock at Cancer Care Western New York. The survivorship support group sign up is there. We also offer a free sign up for a pre-surgical class for breast cancer patients. And all those resources are found on the events page of Great Lakes Cancer Care Collaborative. Thank you so much for listening to me today. And if there are any questions that you have, please feel free to reach out to me. And I look forward to answering those questions and assisting you with information about cancer survivorship.